réew mi.
li mel ni lan.
li mel ni ki ay toogu office ay li nga xam ne moo di ay taabuli office ay computer ay télé ba li nga xam ne moo di bagage yi lopitaan yi di soxla lépp ñu ngi ko fi wàccee fii ci biir réew mi pour lan jaay nag njëg bu yomba ak bagage bu quality fii ci biir réew mi. yéen ñi nga xam ne soxla ngeen li nga xam ne moo di bagage ci li nga xam ne moo di seeni kër yi bugg a sansi seeni kër yi wala samp kër bu bees tàq bugg a faa dugal bagage yu bees yii te yombu njëg doxantu leen seeti Workplace Gambia Limited.
ku bëgg a am bagage yu mel nii fan nga koy amee.
dama ne tontable bu fekkee yaa ngi jógee bourse bi tontable di dem li nga xam ne moo di Tipa Garage sa loxo càmmoñ li nga xam ne moo di Workplace fa la ñu nekk balaa ngay amee li nga xam ne moo di di dem bourse bi ba tey rek boo rombee bourse bi police station bi rek li nga xam ne sa loxo càmmoñ ñu jàkkaarloo garden bi fa la ñu nekk.
waaw su ma leen bëggee am online nag.
dama ni doxantul seeti leen ci seeni Facebook waaye ba tey rek Facebook bi lan lañ fa wax ñu ne Workplace Gambia Limited kese nga rek ci seeni ay number li nga xam ne moo di 70 75 195 nekk ndomba yi nga xam ne yooyu ngeen di mun a jokkoo ak ñoom heure boo leen woowee rek di nga mun a waxtaan ak li nga xam ne moo di ñi fay réew mi moom lu mu doon dama ne xanaa li nga xam ne moo di
viewers all fit to wear that cap today. Although we are not from the same office, and then some of our offices are not directly under the ministry. The nature of our work is all geared towards the betterment of the healthcare system. And I am Mariama Jiba. I work as a communication officer at the CCA Funded Resources in the Gambia in response to the fight against malaria, tuberculosis, and HIV. Themselves, then from there we will go into the discussion proper. So starting from my left,
support officer under the National AIDS Secretariat.
Okay, good afternoon, wonderful viewers. Senior Malaria Control Officer, National Malaria Control Program under MOH.
Good afternoon, National Leprosy and Tuberculosis Control Program, Minister of Health.
Okay, thank you for that brief introduction on Global Fund, role of Global Fund proper. I would like to give some basic facts about Global Fund and then the CCM. Investment in we can say Global Fund is a financial instrument. Global Fund has invested over 200 and is Global Fund always attracts, manages and disburses its funds through a public-private decisions on how the grants to be utilized. This organization have multilateral and bilateral agencies, people who are living with the disease, or CCM Executive Committee that are responsible for decision and general oversight to the grants. Also, we have a technical committee that provides technical assistance to an CCM board. We call it as a National Assembly because all those that have a stake in the response of time will not be on our side. So I will allow my left with Auntie Olimotu to tell us more about GF investment in the area of HIV and AIDS.
Thank you, Mariama. Once again, good afternoon, viewers. The investment or impact of Global Fund in this country is enormous. And as we may be aware, National AIDS Secretariat is Council, and the National AIDS Secretariat is the arm of the National Aid to be able to coordinate all HIV activities, knowing that HIV is beyond the health. In its inception in 2001 by an act of Parliament, and it has been since 2005, they have been the major funders of the HIV response and we have seen enormous impact in it because Global Fund has supported the country available and also available, strengthening the laboratory diagnosis, and also strengthening the disease monitoring aspect of it, and also ensuring for us to have an efficient and robust supply chain management system in terms of this to accommodate HIV services, because when we were starting to clients in confidentiality, this is a good achievement. And generally also we have seen them also capacitating the health system in ensuring that would come our way, like the issue of the COVID. Preparing the country response is enormous. Services, we have testing services. When it comes issues of, we have also opinion leaders in reducing voluntarily to do the testing. Healthcare workers have been trained, come into the health facility, complaining of other minor ailments or other illness, they can also offer, and if they have the virus, because if you test, so it's helping us to curb it. Also, it's helping us to curb it also to ensure that the concentrated population that are having a high and efficient treatment program to ensure that people living with HIV would get the best of care. Thank you.
So if you want to talk about support, we will spend the whole day here. Delimatu will come back to you to translate some of the key messages into the local language so that we want to be precise, because I know time will not, and then the support that you receive. To be precise, because I know time will not, and then the support that you receive.
Okay. Thank you, Mariama, and thank you, viewers. Generally, our interventions are on some ordinary nets that you can buy from the market, in the hospital, in the health facilities and hospitals. Malaria case management, what should be done if it's funded by Global Fund?